I've heard nurses in other places say to me that it can feel as though humanity has been lost, and that has just a huge impact on those nurses' mental health as well. You've said something already about the impact on nurses. Tell us a little bit more, just in terms of, physically and mentally, how are nurses coping?
Yeah, nurses, we have 2 or even 3 types of nurses now working in the field. One, the nurses that are in the hospitals in danger and in hot zones, as we say. We have the other number of nurses that are working in the other hospitals, and those nurses are overwhelmed because they are receiving all the transferred patients, all the critical patients, and the casualties. And starting with, we had some shortage of nurses, as all over the world we have shortage. So nurses are working long hours, they are working overtime, and they are in need even for more nurses to join to be able to cope. And here the order is also helping in that matter. Also, the third category of nurses are working with displaced, because we are working with the Ministry of Public Health and in coordination with the primary healthcare centers in order to also give some care for the displaced people. We have more than 1,200,000 displaced. We have more than 300,000 in common shelters. And among them, we have elderlies, we have young children, we have mothers, new mothers, we have pregnant, and so on. So also nurses are working there. And this is why all nurses are overwhelmed, are working more than they were used to work. This is on the physical side. Yet on the psychological and the mental health side, they are bombarded with lots of, they have lots to deliver, and at the same time, we are short in numbers. We had a drive to ask for volunteers of nurses. We included also the nursing students to help us. They really, we really had a good number of nurses who were really able to help. The drive, we have more than 550 nurses who registered, and we contacted more than 220 nurses so far to work in hospitals, and I mean the hospitals that are in need for more number of nurses in order to cope with the extensive number of patients. Also, we have more than 300 nursing students also who registered, and we are also using the help of the students in the primary healthcare centers and in the shelters. So we are exhausting all our nurses, but I believe they are there for each other. We are there for our people to deliver the best healthcare we can.
As always, nurses do. It's incredible to hear of the courage of nurses and the student nurses who are putting themselves forward to help. President, last time we spoke, you shared that more than 70 healthcare workers had tragically been killed over the last couple of weeks. ICN estimates that in the last couple of years, there's been more than 1,000 nurses and healthcare workers killed in all conflict zones. Now, I know that you talk about your white army of healthcare workers, but that shouldn't mean that any nurse is expected to be a martyr. Is that a fear that nurses have, and what's the latest number of deaths that you're able to report?
Unfortunately, the number is increasing. Since October 3, the Minister of Public Health announced 102 casual martyrs and more than 225 wounded. Yet the number increased, and we have more than 120 martyred healthcare worker. We have more than 230 wounded. We have 11 hospitals directly targeted. We have more than 46 ambulance and other healthcare facilities, and were also targeted. Also fire trucks, we have ambulances, we have lots of more than 130 were out of, they cannot function anymore. They were also directly hit. So imagine the physical and the not only, I mean, as healthcare workers, we are there, but you need also tools to operate. If we are without tools, if we are without our hospitals or institutions, how can we deliver a quality care?